Hi, my name is Lindsay Hurst and I'm a chartered physiotherapist and clinical Pilates instructor, and I'm here at the Leeds Physiotherapy and Pilates practice to give you a 30-minute beginner's workout Pilates for back pain. Now our course is run as a 6-week course, and over the 6 weeks we tend to progress you at a level that you're comfortable with, and this session is just a basic week 1 lesson. So we're going to start with some foot placement. So I want you to stand yourself comfortably on a mat or on the floor. Come and stand with your feet together. So we want your toes and your heels touching to begin with. Let's walk the toes out first of all, and then we'll walk the heels out now so that your feet are level with your hips. Now, to make sure you've got even weight and pressure through the feet, I'm going to ask you to sway your body weight from side to side. So I want you to just feel how that pressure differs from one side to the other. So if you've potentially been suffering with some back pain on one side, some leg pain, some sciatica perhaps, then you may very well have just lost that ability to weight bear fully through that leg. So let's just encourage normal weight transference and normal weight bearing. Once you feel comfortable to do so, I want you to come and rest so you've got even weight between both feet, and then allow your body weight to come forward. So as we allow our body weight to come forward, we'll feel that gripping sensation through the toes. Let's peel our weight back onto our heels now, almost lifting the toes up. Let's do that again in each direction then, so slowly forwards, gripping through the toes, and then peeling that weight back onto your heels. I want you to now come and rest somewhere between the two extremes for me now, so you feel comfortable that you've got even weight and pressure at the front and the back of your feet. Let's now lift up the inner surface of your feet, rolling onto the outer edge of both feet, and then we'll roll down through those arches, lifting up the outer aspect. Let's do that again in each direction then, so rolling from one extreme to the other, pressing down through the outer surface and then coming down through that inner edge of your foot. Come and rest for me now somewhere between, again, the two extremes of movement. So you now want to be very much aware of that pressure you have going down through your big toe, your little toe and your heel. And we call that your weight-bearing triangle. So you want to make sure you're evenly distributing your weight between the 2 feet, between those 3 points of the triangles on both sides. Now once we've got a good foot posture, we should find it easy then just to relax the thighs. So I don't want you to be tightening your kneecaps. I want those kneecaps to stay relaxed. Let's move up then to the pelvis. So place your hands for me onto your pelvis, and I want you to find neutral. So we're going to imagine our pelvis now as a bucket full of water. Let's pour some water out of the front of that bucket, so you feel your tailbone just lift out behind you. Let's now tuck that tailbone under, so you're flattening the spine. Imagine pouring water out of the back of that bucket now. Do that again in each direction then. Feel that movement, feel that mobility in your lumbar spine, so your lower back just stretching from one position to the other. Let's then come and rest somewhere between the two extremes. Now we call this position your pelvic neutral position. Now again, if we use that visualization of the bucket of water, just imagine that bucket of water full to the brim and you're holding that level now. Arms down by our side, moving up the body. Let's think about our chest position. I want you all to visualize now a headlight on this chest bone here. Now imagine that headlight shining forward. So we want to be careful that headlight's not dipping down. So lift that headlight up, stand proud through your chest. Imagine widening out the collarbones and tucking your shoulder blades down towards the base of your spine. Once you've got that width across your chest, moving up to the head and neck then, we'll tuck that chin down. Imagine we're trapping a little tennis ball between the chin and the chest, and we're just holding that neck in neutral. We're going to think about activating our core muscle now. You've got 2 ways you can do that. So we're either going to lift and engage the pelvic floor, so that being the muscle that if you're desperate for the toilet you're holding in, or we're going to visualize this area between our belly button and our pubic bones, this lower abdominal area. We're going to pull that lower abdominal area in towards our spine without losing that neutral position, and you want to just maintain a contraction at about 1/3 of your maximum contraction. So don't force the muscle to work, you want to just lightly be contracting it. So either the pelvic floor or the lower abdominals, doesn't matter which, because the two work together. Once you've got that contraction there, let's take a lateral breath in, and we will talk about lateral breathing. We want to breathe right the way into the base of your lungs, expanding your rib cage out laterally. So let's take that lateral breath in. As we exhale, maintain that core contraction. I want you to just start by rising up onto your tiptoes. And all we're going to do here is just concentrate on maintaining that core contraction whilst we're peeling the weight from the heels up onto the tiptoes. Let's do that again now. Good posture, head light forwards. Keep those lower abdominals or your pelvic floor in, lower down. Let's again think about that bucket of water then. Keep that bucket of water still as you're rising onto the tiptoes and lowering down. So what we're trying to do is we're trying to just contract this muscle and maintain that contraction as we're moving, and we're almost reminding that core muscle that that's what its job is to be doing now, is to be supporting and stabilizing the spine and pelvis as you're moving. Let's add in some arm movements then, so slowly reach your arms forward. Keep that pelvis level, keep your core muscle contracting. Let's continue with those arm lifts, rising onto the tiptoes and then slowly back down again. Breathing wise, we exhale as we rise onto the tiptoes and then we inhale to lower down. Breathing out and breathing in. Good, well done. Keep an eye on that core muscle, make sure you're maintaining a contraction throughout your movement. And keep that pelvis nice and still then. We're just going to make your next one your last one. Rising up again onto those tiptoes and then slowly down. Hold your postures now, bring those shoulders back again, head light forward, lower abdominals pulled in, maintain that pelvic neutral position. Take that lateral breath in again. This time as you exhale, you're going to just peel your right heel up away from the floor. Concentrate on keeping that pelvis level. Let's then inhale as you lower the foot back down to the floor, and do the same now for me on that left side. Keep the pelvis level and then inhale to lower down. We want to think about that bucket of water again. Keep that water in the bucket, full to the brim. Careful not to lose that neutral position. Keep the lower abdominals or your pelvic floor switched on throughout your movement. And just continue switching from side to side there then. Don't lose your good posture, shoulders back, chin tucked in. Let's challenge you a little bit further now by adding in some arm movements. So lower abdominals drawn in, pelvis stays level. Raise the right heel away from the floor at the same time as lifting up your left arm. Let's then inhale to lower those back down to the floor. Back up again, opposite side. So we're reaching opposite heel with opposite arm lift. Keeping again those lower abdominals switched in all the time. Our breathing technique now, we exhale as we lift up. And then we inhale as we lower back down. Keep that core muscle working. Now if you feel comfortable with this, we'll just start to speed our movement up. If not, then you stick with this level. So you're just progressing at a level that you feel comfortable with. So to speed the movement up now, as one side lowers, the other side's lifting. We want to maintain that good posture, keep that head light beaming forwards, and keep those lower abdominals or your pelvic floor muscle contracting all the time we're moving. And remember, it's just that subtle contraction, third of your maximum contraction whilst we're working through these movements. We're going to do one more on each side. And then when you finish that last one, I want you to lower your arm and foot back down to the floor. Give your shoulders a big shrug and a roll around now then. Let's place those palms together. Push your hands down. Reach both hands up towards the ceiling now, looking up. So we're stretching through the neck. Careful not to arch your back. I want you to release that position down now. Arms just to shoulder height, bending the knees. Stick your bottom back. And we're going to, as we exhale, just rotate our chest around now as we do a spine twist to one side of the room. Keep those knees still, so your knees don't want to roll with you. Rolling now to the opposite side. Come back in again, and if we can just do that once more in each direction now. So we're just improving that rotation now through the thoracic spine. And when we finish that last one, we'll come back to the center, straighten the knees, give those shoulders a shrug and a roll around again, palms together down. Let's reach those hands back again towards the ceiling, stretching up, and then we'll release that position down. Well done. Okay, we're going to come down into a lying position now. So when we're lying down, we'll need some head support. So if you've not got a head block, then you want to just get a little towel folded over or a cushion. So come and lie yourself down, flat down on your back now. You want to rest your head on that cushion or on your towel. And you want to now have your knees bent. We've got our heels level with our bottom now. So you want to have a little bit of a gap between your knees, and then we want to think about our pelvic position. So again, we want to find that neutral stance. So if I can get you to imagine that you have a little Malteser underneath your lower back. Let's flatten and crush that Malteser now. So you've just completely made contact with the floor. I'm going to ask you now to arch your back away from the floor. So you're pressing your tailbone down. So you've made a little bridge there for that Malteser. Let's do that again in each direction now then. So flatten your back down towards the floor. And then arch your back away from the mat there, lifting up that lower back, pressing the tailbone down. Now if you can come and rest somewhere between the two extremes there, we're resting there in what we call our neutral position again. So you've just got that little curve in your lower back, and you want to maintain that now throughout these exercises. Your rib cage wants to stay soft down towards the floor, chest wants to be wide, and we're lengthening out the neck. Now we've set our position, let's think about activating the core. So draw in again the pelvic floor, or draw those lower abdominals in, so this area between the belly button and the pubic bone again. Just draw that in towards your spine without flattening your back. So remember, we're just keeping our back in contact with that Malteser. Now we're going to start with an exercise called one leg stretch. So if I can get you to take that lateral breath in again. Now as you exhale then, let's straighten out the right leg, reaching that right foot towards the end of the mat, and then we'll inhale as we return back to that starting position. Do that again then. So let's exhale on the left side this time, reaching it down towards the end of the mat, and then inhale to return. So I want you to just keep switching from side to side now. There's two ways you can do this. The more challenging way is to hover the foot. So you imagine that you've got a little tennis ball that you're rolling towards the end of your mat and then back in again. Or if you find that too difficult, then keep your foot in contact with the mat then. So you're just giving yourself a little bit more feedback, a little bit more support as you do your one leg stretch. Each of which you need to make sure your back stays in contact with that Malteser and you're keeping that core muscle contracting. Let's just do one more of those on each side now then. Remember to exhale as you straighten the knee, and then inhale to return. That's brilliant, well done. Moving on now to an exercise called hip twist. So this is a rotational controlled exercise, so you want to make sure your pelvis stays level. So let's draw those lower abdominals in. We're going to imagine we've got a spirit level this time, resting across that lower tummy. I want you to concentrate on keeping that spirit level still. So let's now take a lateral breath in. As we exhale, maintain the core contraction as you allow your right knee to drop away from your left. Now keep that left knee still. That right knee drops out as far as you feel comfortable. Let's now inhale to return. Do the same on the left side. So the left knee drops out now. Breathing out as that knee drops away from midline. Breathing in to return. Remember that spirit level stays still. So as your knee drops out to the side, make sure your pelvis doesn't roll with it. So you're going to find that perhaps you might be different on either side. Or you might find that you can only go a tiny amount before your pelvis starts to move, and that's your level of control. So you just stick with the level that you can control, and eventually then you'll learn to stabilize that little bit better, and you'll be able to go a little bit further with these movements. Remember to breathe out as the knee drops away, and breathe in to return then. Keep those lower abdominals pulled in. We'll do one more of these on each side. Exhale as the knee drops out. Inhale to return. We're making your next your last one then. Breathing out as the knee drops away. Breathing in to return. That's brilliant, well done. Now I'm going to get you to bring your right leg now into a single tabletop position. So draw the lower abdominals or pelvic floor in first. Maintain this pelvic neutral position as you lift the right leg into single tabletop. Now let's take a breath in there. Exhale now, straighten out the knee. If you can control, I want you then to lower the foot down towards the end of the mat, and then we'll inhale to return back. We're going to place that right foot back down on the floor now and lift up the left side. As we exhale, the left knee straightens. We lower that foot down towards the floor, and then we inhale again to return. Now if you find that you can't keep your back in contact with your Malteser now as you're extending the leg, then I suggest that you go back to that one leg stretch at level 1 where we're just rolling that tennis ball towards the end of the mat. So this is your level 2 position. So you just again need to make sure you're working at the level you can control. You need to be able to keep those lower abdominals or your pelvic floor switched on as we're moving. And we need to be able to use those core muscles to keep that back stable throughout this exercise. Let's again do one more of these on each side now then. Exhale to straighten, inhale to return, and we'll make your next one your last one then. We exhale to straighten, inhale to return. Good, well done. I'm going to get you to do a stretching based exercise now. So bring your feet and your knees together. Reach both arms out wide now then. I want you to take a breath in. As we exhale, both of our knees are dropping down to the right. We're twisting our head to the left. So we're stretching there through the spine. I want you to then go back to the middle. You want to go as far as you feel comfortable. We'll do the same then to the opposite side. So both knees to the left now, head to the right. Again, just go as far as you feel comfortable to get that stretch. Let's come back in. We'll just do that now once more in each direction then. So both knees to the right, twisting your head to the left, feeling that stretch. And then coming back to the center. Let's do that one more time. So both knees to the left, head twists to the right. Well done. We're going to come back to the middle. Bring your arms back down by your side. Now keep the feet and the knees together now. We're going to roll onto our sides. So if I could get you to turn onto your side now. Bring your head now to the front of that block, cushion or towel. Make sure you've got enough support there to support your head. We've got both knees bent forward and we want the hands out in front of us now. We're going to do a movement called your arm openings. And this arm openings is again another mobilizing exercise. So it stretches that thoracic spine again into rotation. So let's take a lateral breath in. As we exhale, let's lift that top arm up. You're going to roll back now, watching that hand as you roll. Chest faces the ceiling, and then we inhale as we bring that arm back to the starting position. Let's do that again then. So let's exhale, lifting up, rolling back, chest faces the ceiling, and then we inhale to return. So again, you're just going as far as you feel comfortable. Now you need to make sure that your body is rolling with your arm and you're not just rolling back, moving the shoulder. So we actually want to feel that rotation through our mid-back. Let's just do another 2 of these then. So breathing out as we roll back and then breathing in to return. Making your next one your last one. Don't let those knees lift up away from the floor then. You keep those knees pinned down. And then again we're breathing in to return. From there now, I'm going to ask you just to bring your bottom arm underneath your block, your towel or your cushion. Place that then in between your shoulder and your ear. We're going to then bring the heels level with our bottom now. You want knees bent forward. Place your hand then on top of your pelvis. We want to find that neutral position again. So let's tilt that pelvis forwards and then tuck that tailbone under to flatten your spine. Come and rest for me there somewhere between the 2 extremes of movement, pushing that top hip down. I want you then to activate your core muscles. So draw those lower abdominals in or your pelvic floor. Keep your rib cage soft, chest wide, neck lengthened out. And as we exhale, we're going to lift the top knee up as we do your clam at level 1. Let's now inhale as we lower that knee back down to the bottom knee, and again then exhale, lifting up and inhale to lower. Now we need to make sure here that our back stays still, so be careful not to roll back. So you can either with this imagine that there's a brick wall behind you and that brick wall is going to stop you from rolling back, so we can then just isolate that movement to the hip. So the spine's not compensating. And again, it's just within that level that you can control. So if you're really quite weak in this muscle, you might not be able to lift the knee very far, and that's absolutely fine. Eventually you will strengthen up so you can get that knee higher. Keep those lower abdominals pulled in. Now the other way that you can try and stop your back from rolling backwards is by imagining you've got some headlights in the front of your pelvis here. Now keep those headlights shining forwards. You don't want those headlights to start rocking up towards the ceiling with that knee. So if that starts to happen, it means your back's rolling and your pelvis is joining in. Let's do another 2 then. Exhale to lift, inhale to lower, making your next one your last one. And when you finish that last one, you're going to relax the leg back down. We're going to now work the glutes in an extended leg position. So maintain neutral, draw those lower abdominals in. The bottom leg is going to stay bent, and we're going to straighten out this top leg now then, pointing those toes. Careful not to lose neutral. As we exhale, that top leg's lifting up. Let's pull those toes towards us now as we inhale and lower. Pointed as we lift up. And then flexing those toes now again to lower back down. So you want to be able to do this again without letting your pelvis and spine join in. So we keep that pelvis level, keep those lower abdominals drawn in. Now if you're finding that this is too difficult or you can't maintain a neutral position, then I suggest you go back to that clam level 1 exercise. So only progress up to higher levels if you're comfortable to do so. Maintain the core, so we're always again reminding that lower abdominal area or your pelvic floor to be working as we're moving through these exercises. We're going to do another 3 of these now then, breathing out and then breathing in. Last 2. Good, well done. Making your next one your last one. Brilliant, well done. When you finish that last one, I want you to just come and relax your leg down. Now you might find that your hip is aching a little bit after those movements, so we'll just give it a little bit of a rub there just to help that muscle recover. We're going to now come onto your opposite side, so if I can get you to bring your block, your towel or your cushion to the opposite side of your mat, and then come down again into that side lying position. First of all, we've got the arm openings, so we want both hands out in front of us. Your head again is at the front of your block, knees bent forward, hands together. Let's take a lateral breath in there, keep the knees down, and as we exhale, we're going to lift that top arm and we're going to roll back so our chest faces the ceiling. Remember to watch that arm as you roll back, so you're fully opening up the chest and also just mobilizing the neck as you roll back. You might feel a little bit of a stretch going down your arm with this exercise as you just start to feel the neural tissue starting to stretch a little bit. So again, just go as far as you feel comfortable. And it's quite normal to feel that this might be different to the other side if you've got a little bit of a restriction. And we're just trying to loosen off the back, maintain the mobility you've got, and potentially improve that mobility. Keep those knees together then as we just do another 2 of these. Remember to exhale as you roll back, and then we'll inhale to return. Keep the knees down. Careful not to lift those knees. So when we finish that last one now, let's bring our bottom arm underneath our blocks. If we can then rest that block, towel or cushion between now your shoulder and your head. Bring those heels back so they're level with your bottom, ready for the clam at level 1 then. Hand on top of your pelvis. Let's find that neutral position. So we tilt the pelvis forwards and then we tuck the tailbone under. So we're going between those 2 extremes of pelvic movement now, and then come and rest somewhere between the 2 so you're in neutral. Pushing that top hip down just to encourage that length either side of your waist. Keeping your rib cage down on the floor, let's draw those lower abdominals in. Now as you exhale, lift that top knee up. We want to then inhale as we lower back down. Keep the pelvis still. Remember those headlights on your pelvis, or remember that brick wall stopping you rolling back. You want to breathe out as you lift the knee. Breathe in as you lower down. Making sure we're aware of those lower abdominals or our pelvic floor then. Now we're working a muscle called your gluteus medius muscle here, and your glute med muscle you'll feel contracting at the top of your hips, or top of your buttocks. So that's where you want to feel this muscle contracting to lift that knee. And again, you might find that it's different on one side compared to the other, and you perhaps might be able to just coincide that with your symptoms that you're having. Let's just do 2 more then. Keep those lower abdominals pulled in. Last time. Brilliant, well done. Now then, moving on to that extended knee now. If you're not comfortable with the extended knee, then stick with your climb at level 1. Let's draw those lower abdominals in then. Keep that bottom leg bent, straighten out this top leg. So you're hovering that foot. We're pointing the toes to lengthen the leg. Let's inhale to prepare, and as we exhale, keep those lower abdominals in as you lift that top leg. Pull your toes towards you as you inhale now and lower down. Pointed now as we lift, and flexing there again to lower down. Keeping everything else in a good strong posture, so chest upright, rib cage down, head and neck in neutral then, drawing those lower abdominals in. Be careful not to let this waist shorten then, so you're keeping that pelvis down away from the rib cage. Isolating that now to the glutes, so you want to be able to feel that again working in those upper parts of your glutes. You don't want to feel this working in your back. If you can feel your back joining in, then you've lost the exercise, so you need to go back down a level. We're going to make your next 3 your last 3 then. Keep those lower abdominals pulled in. Last 2 now. And making your next one your last one. And when we finish that last one, let's come and bend that knee back. And I want you to just give that hip a bit of a rub there again, just to help that muscle recover. We're going to straighten out our knees now. We're going to roll over onto our tummies. So if I can get you just to bring that head block, head support out. Lie yourself down flat on your tummy, and you want to just rest your forehead down onto your head support. Now we're going to just relax the arms wherever we feel comfortable with this next movement. I need you to become conscious of your spinal position. So let's press the pubic bone down towards the floor, and if we can maintain that pubic bone pressure, then we know that the spine is likely to stay still. You want your feet at hip width distance, pointing out away behind you. Let's draw those lower abdominals in then, so pull that pelvic floor or lower abdominal area in, hold that contraction, take a breath in. As you exhale, I want you to become conscious of the glute muscles, so your buttock muscles tighten now as you lift the right leg up. You feel the thigh lift up away from the floor as well as that lower leg, and then we inhale down. We do the same on the left side then, so the left leg lifts up, and then we inhale down. Try and keep your knee as straight as you can with this movement then, so I want you to be careful not to bend and buckle the knee. So let's imagine we're trying to reach this foot to that wall behind us. You should find then that that really helps keep the knee straight, and it'll also help fire up those glutes that little bit better. Now remember, we want to keep that pubic bone pressed down so that we know the spine's not joining in. Just feeling that work, that contraction through the glutes. And we'll keep going side to side. And again, we'll just do one more on each side. And then we're going to progress that now then. So we're going to progress to allow the arms to join in. So if you can take both hands up above your head. Now I want you to have your palms facing each other, your thumbs pointing towards the ceiling. Press that pubic bone down again. Engage the core by pulling the lower abdominals or the pelvic floor in. Now as we exhale, we're going to lift the right leg and the left arm at the same time. Let's then inhale to lower. Do the same on the opposite side. So this time left leg, right arm. Now if you find that this is too difficult and you're not able to maintain a neutral position, then go back down just to working the legs and keep the arms in a rest position. Now you want to have your thumbs pointing towards the ceiling so that we've got our shoulders in a good position. We also want to make sure that we're not creating any tension in the neck and shoulder area, so keep those shoulders pinned down away from your ears as you're lifting. Keeping your forehead down on your block, and again maintaining that lower abdominal contraction now. If we can just do one more on each side. And then when we finish that last one, we'll just come and relax those arms down by our sides. Keep your feet down on the floor this time now. We're finishing off with an exercise to work the lower shoulder blade area. So let's press the pubic bone down. Engage those lower abdominals. Now as we exhale, we're going to lift the shoulders up away from the floor. Draw those shoulder blades down, and then lift and hover your hands. I want you to then inhale as you allow those arms to come back down to the floor. Do that again then. So let's exhale, peel up, and then we'll inhale to lower back down. I want you to do that again. So we exhale, lifting up, and inhale back down. Let's maintain that core contraction there, so keep those lower abdominals pulled in. Exhale, and then inhale. Well done. Lifting up and lowering down. Let me just get you to do 3 more of those then. So we exhale, and then we inhale down. Last one. And then we'll finish off there then. I'm going to get you now just to come and push yourself up into a 4-point kneel position. Use those core muscles whenever you're moving. And then let's sit back on our heels now into the shell stretch position. So you're sitting back on your heels, resting your head down. And we keep those hands far out in front of us there then, so that we feel that stretch lifting up the rib cage and lifting through the shoulders. We're going to hold that now as we take in some deep breaths. And just feel then those vertebrae just stretching up, that rib cage lifting through the spinal muscles. And we'll do one more big deep breath in. And then relaxing into that stretch as you exhale. Okay, from there now we're going to come up into standing. So if I can get you just to bring yourself up onto your knees. Use your core muscle when you're moving again then, so draw those lower abdominals in. Bring one foot out in front of the other. Push up then into standing, turning to face forwards. I want your feet back in that hip width distance position. Toes pointing forwards. Think about those triangles now. So that big toe, little toe and heel is where you want to have that weight distribution. Thigh muscles should be relaxed, so let those kneecaps drop. Now finally finishing off with this pelvic position. So let's tilt your pelvis forwards and then tuck that tailbone under, and then if you can come and rest in that midway position of neutral, arms down by your side, lift up that headlight now, so you're widening out then through your chest, standing proud through the chest. Draw the shoulders down, shoulder blades down towards the base of your spine, and then lengthen out your neck. I want you to, for the rest of the day today now, just try and imagine a helium balloon coming out of the crown of your head, and just visualize that really stretching and lengthening your spine up towards the ceiling. And if you can, keep prompting those lower abdominals or pelvic floor muscles into contracting. Okay, well done. Thanks for watching, and hope to see you again soon.